I'm sure when you were young, your parents and your teachers had told you to stay positive in life or think positive thoughts because positive thoughts lead to positive actions in life. Well, it turns out they were right, and Dr. Aaron Beck would also agree. If you don't know who Aaron Beck was and how our thoughts affect our emotions and our behaviors, then keep watching this video. Hello my curious friends, and welcome back to my channel. Mental health and mental disorders is a very common topic of discussion these days. Mental disorders are a leading cause of death worldwide according to World Health Organization. 1 in every 8 people suffer with a mental disorder according to WHO. In 2019, 301 million people were living with an anxiety disorder and 280 million people were living with clinical depression. These numbers are quite big and they tell us how common mental disorders are. We know that mental health is as important as physical health, and suffering from any mental disorder should not be seen as a sign of weakness because anyone, literally anyone, can suffer from mental disorders. The good thing is that we have medications and therapies to treat mental disorders, such as clinical depression, anxiety disorders, or phobias. One such revolutionary therapy is called CBT, or cognitive behavioral therapy. There are many therapies that come under CBT, and one of the most widely used ones is called cognitive therapy, developed by none other than Dr. Aaron Beck, who had made a revolutionary contribution in the area of mental health. In this video, let's deep dive into the life of Dr. Aaron Beck and understand in great detail what exactly is cognitive therapy. Let's understand how our thoughts and our emotions affect our behaviors. How to know if someone who is suffering from clinical depression or an anxiety disorder can be treated by talking with a person. How to know if cognitive therapy is the right treatment for you or someone who is suffering from depression or an anxiety disorder. And what happens when people don't respond to therapies. If you're interested in these questions, you're curious about them, then stay tuned till the end of this video. Also, don't forget to hit the subscribe button. This will keep up my motivation to bring high quality, insightful and knowledgeable content to you guys. A brief life history of Dr. Aaron Beck. Beck was born on July 18, 1921 in the US. He had graduated with a bachelor's degree from Brown University, and after that he went to Yale to study medicine and he earned his MD degree in 1946. Beck had decided to choose psychiatry for his medical training, and after completing his psychiatry rotations, he got fascinated by psychoanalysis. Psychoanalysis is a whole new topic, so if you're interested in it, let me know in the comment section down below. So coming back, he got really fascinated by psychoanalytic approach, and he had spent a lot of time studying psychoanalytic approach to treat depression in his patients. But later on, he realized that the psychoanalytic approach was not very scientific. His interest then shifted to cognitive approach, and that's when things changed. As a psychiatrist, he saw many patients who were suffering from depression, and during that time, he saw some sort of a pattern. He saw that his patients who were suffering from depression kept having these negative thoughts about themselves, about the world and other people. What's interesting is that people who kept having these constant negative thoughts actually started believing in them. To give an example, let's say I'm someone who thinks that no one loves me and no one cares about me. So if I'm going to keep having these thoughts all the time, then sooner or later I'm actually going to start believing that no one cares about me, no one loves me, even though this is not true and it is just in my head. This let Beck help his patients identify these constant negative thoughts and replace them with positive thoughts, helpful thoughts, realistic thoughts, in order to result in positive behaviors. Because according to him, these negative thoughts led to clinical depression. So this is the basic idea behind cognitive therapy. And now let's deep dive into how does it actually work. And we will learn this using a hypothetical example of a boy named Jack. Beck believed there are 3 things that were mainly responsible for clinical depression in his patients. First is cognitive triad, second is negative self-schemas, and third is the cognitive distortions. Don't worry, I will explain these terms in the simplest possible language. Thinking about cognitive triad, Beck believed that in depression, people have negative thoughts about themselves, about the world and other people. And when it happens all the time, 24/7, then it leads to clinical depression. Let's say Jack is someone who thinks that he's a failure, no one cares about him, and he's hopeless in his life because things will never change for him in the future. So Jack in this case is kind of stuck in this vicious cycle of negative thoughts about himself, about the world and other people, and this is what causes depression in him. Negative self-schemas are basically thoughts that are negative about oneself. For example, in this case, Jack's negative self-schema can be that he's a total failure and he's never going to be successful in his life. Negative self-schemas are very unhealthy and they can cause a great amount of damage to one's self-confidence. According to Beck, cognitive distortions are illogical thoughts. Let's suppose Jack thinks that since he performed badly in one of his exams, he's going to perform poorly in every other exam, without realizing that since he got sick, he could not study much. In psychology, it is called overgeneralization. Another cognitive distortion can be all or nothing thinking. So for example, in Jack's case, he might think either he gets A grade in every other subject or he is not a good student at all. People with this cognitive distortion usually look at the world as if it's either black or white, and it can be very self-defeating. How do therapists or psychologists actually conduct cognitive therapy, and how does it help someone who is suffering from clinical depression or an anxiety disorder? In order to learn this, we will again go back to our friend Jack, who is suffering from clinical depression. Let's say Jack went out for a walk one day and someone he knew passed by him but did not say hi or smile back. So in this situation, Jack's first thought could be that the person ignored him and doesn't like him. His negative emotion could be that it made him feel sad. So this negative thought and this negative emotion might lead to a negative behavior, which could be that just stay isolated and do not talk to anyone. This is what therapists target during these sessions. This vicious cycle of negative thoughts, negative emotions, and negative behaviors. What will a therapist do then? So if Jack goes and see a therapist, they will help him replace these negative thoughts, emotions, and behaviors with positive and realistic thoughts, emotions, and behaviors. Now let's get back to the person Jack thought ignored him. A therapist might help Jack replace his negative thought, which was that the person ignored him and doesn't like him, with a more positive and realistic one, which could be that the person may be struggling in his life already, or maybe they didn't pay attention at all in the first place. This is how cognitive therapy works, and it helps a person challenge their negative thinking and replace it with positive thinking in order to result in positive emotions and positive behaviors. It helps a person train their brain and develop the skills in order to tackle the negative events of life. Cognitive therapy is not positive thinking, and it is not equivalent to self-help or listening to motivational speakers on YouTube, and it should only be done by professionals. And I will get back to this very shortly in this video. Important question remains: what happens when people don't respond to therapies? Cognitive behavioral therapy is a very effective therapy, but still it doesn't work for everyone. And in such cases, there are alternatives, such as medications, other therapies, and even trying the same cognitive therapy but with a different therapist. Sometimes finding the right therapist can take some time. Getting back to motivational speakers and positive thinking. You will find loads and loads of content on the internet where everyone is going to try and pretend to be a therapist without having zero knowledge about the deeper understanding of mental health and mental disorders. I'm not against motivational speaking. I think sometimes listening to other people's stories can be very uplifting. But as I said just now, mental health and mental disorders can be very complicated to understand, and it is very important that the information comes from someone who is an expert and has studied the subject extensively. Saying to somebody who has depression to stay positive and be positive is very wrong and unethical on so many levels. And such people require professional help and not a general advice coming out from friends or family members to stay positive in life. Beck died on 1st November 2021 but made such an important contribution in the area of mental health and psychotherapy. He had dedicated his entire life in alleviating the human suffering, and we all owe him so much. Cognitive behavioral therapy, as I said, is a very effective therapy, and it can be very powerful in treating people who have depression or anxiety. He had taught us that by challenging our negative, self-defeating thoughts, we can change our behaviors and eventually live a positive, fulfilling, and healthy life. Once again, don't confuse CBT with self-help that comes out of motivational speakers or you read in self-help books. Cognitive behavioral therapy is a scientifically valid psychotherapy, and it should only be exercised by health professionals who are real experts. Okay guys, that is all for today. I really hope that you enjoyed watching this video. Please like it, share it as much as you can before you go and watch something else on YouTube. Please hit the notification bell so that you know instantly whenever I upload a new video, and also subscribe to my channel. If you're going to subscribe to it and more people are going to subscribe to it, then it is going to keep my motivation to bring these high quality videos for you all. Until then, take care and stay happy, and I will see you in my next video.